Right. Hi, everybody. I'm David Stack, the president of CAPS. And today we're going to be speaking to two dental students, Anette and Hyunseo Lee. And we're going to be learning about what their experiences are like at dental school and just kind of get to chat with them and see what's what and what, one might expect to experience when attending dental school or, through the application process, things like that. So if you guys would like to just quickly introduce yourselves, say what school you go to and your year, and maybe what you're interested in as far as dentistry goes.
Yeah, I can go first. So hi, everyone. I'm Hyunseo Lee. I'm currently a third year at the University of Florida College of Dentistry. So far, I plan on just doing general dentistry. I'd like to do a one-year AEGD program, though, out of dental school, and then probably just start working right away. I can go into more details as to why I kind of chose this route, but we'll talk about that later. But yeah, nice to meet everyone.
Hi everyone, my name is Annette. I am a D2 at NYU. I am not sure what I'm thinking of specializing in. I am leaning kind of also towards general, but there has been some recent interest in periodontics, so I've been thinking about that, but I haven't set my mind on anything just quite yet. But definitely after dental school, if I don't specialize, because I want to stay in New York, I'm going to have to do a one-year residency. So that should give me the experience that I need to kind of join the field as a general dentist.
Great. So thank you for being here again. So we'll start off with, our first question, which is, what made you interested in dentistry? What made you want to be a dentist? And either one of you can jump in.
Sorry, I'm getting a call. Sorry about that. So I actually have a lot of dentists in my family, and oh my goodness, I'm so sorry, guys. Sorry, that distracted me. I have a lot of dentists in my family, and so I was considering other options as a first year while I was at Columbia. I definitely explored, shadowed some lawyers and things like that, but I found that within the field of dentistry, most dentists are really encouraging and say that it's an amazing profession. And I always encountered that dentists would say, yes, you should definitely become a dentist. Whereas I was thinking about law, lawyers are like, no, never become a dentist. Doctors are like, don't do this to yourself. Yeah, and plus I saw the life and I thought I would fit in really well.
For me, I personally just, in terms of a career, I think it's important to consider that you will be most likely doing this for the rest of your life. So it's important that you do commit to something that you enjoy. And for me, I wanted a job that I have to kind of like constantly use my hands. I do enjoy the arts, and I'm a more hands-on type of person as opposed to just a job where I'm, just purely communicating with people. But dentistry has kind of the best of both worlds in the sense of, yeah, you are part of, the health profession. You're able to immediately treat people, which I thought was also great. Someone comes in with pain, you can most likely solve their problem kind of right then and there. And it's most likely not that invasive. So just kind of that quick, simple solution that we could have for these patients was also great. And you can also, you just have a personal bond with patients throughout the day, throughout, the job. So for me, I think that was in the lifestyle. I think it's a huge thing to consider nowadays in terms of that work-life balance. I think that was very important for me as well.
And what was the transition like from undergrad to, dental school? What kind of went into that? And can you just, speak to your own experiences of going from being an undergrad to a dental student?
So for me personally, dental school is hard, but I'm gonna go ahead and say that my undergraduate experience was a lot tougher than dental school is right now. I don't know if it's because my transition from high school to undergrad was harder than my transition from Columbia to NYU. That could be part of it. But personally, I think that exams here, people aren't trying to trick you. There's not a lot of like, here's the information on the slides, now apply it to like this upcoming research, which I feel like was a lot of my science exams at Columbia. Whereas here it's like, these are the slides, know the slides, you're gonna be tested on the slides. So I would say that was definitely something that I found was a plus. I think in terms of rigor, I was totally prepared for the rigor of dental school. The people are great. I love it. You have to be a certain kind of person to want to become a dentist. So I feel like the transition was pretty easy. It was easy to get along with people. I feel like that transition was pretty good, actually. Anything else that I should mention about the transition, David or anyone? No? Okay.
For me, so I think like Annette said, it is very different from undergrad in the sense of I felt that the undergrad courses, there's a lot of critical thinking and application, which is kind of something that I liked more. And dental school, it's not just dental school, but any health professional school, just the nature of our profession requires that we just memorize a ton of just facts. It's really just, they're throwing so much information at you and you are taking a lot of courses, lots of credits, and it's all basically just science courses that you've already taken, but maybe just a little bit more in detail. But like Annette said, the exams, at least at my school as well, we're not a pass-fail school, so we still do get graded, but I know other schools are pass-fail, so that does take a lot of pressure off of the students. But it is, I think the main adjustment for me was kind of also that 8 to 5 day where, you are in class and just sitting through multiple lectures back to back to back, trying to keep up with the material so you're not feeling overwhelmed. Is kind of a huge adjustment. And another huge factor is you're in sim lab, you are practicing hand skills. So it's not just memorizing and studying. Now you have to also spend extra time either after classes or on the weekends to go in to practice your hand skills for the sim lab courses, whether it's waxing or operative, profs, all of that stuff. And I think another thing, you'll notice that everyone's kind of at a different level in terms of experience. So a lot of these students were previous dental assistants or hygienists. So everyone is kind of at a different level in terms of just knowledge and experience. But, as long as you put in the effort and the work into it, it's very, very doable. So I think that was like kind of the biggest adjustment for me.
Great. And I'm just going to mention now, if you're afraid you're not answering the question or, anything like that, we're going to be doing a Q&A at the end for the people who are here. So either, you can tack something on at the end, or somebody will be sure to ask a question that'll, hit that. So would you be able to tell us, each of you, a little bit about the school that you're attending? Maybe what you like about it, what makes it maybe special, and how that's kind of shaping your experience.
So NYU is one of the bigger dental schools that we have here in the US. My class size started at around 380. Now I think it's a little bit more like 360. A few people kind of fell behind. Surprisingly, though, the student-to-faculty ratio is actually pretty good. I find that I don't really have a problem getting help in the sim lab. There's actually probably like 25 of us in the sim lab at a time, and they have like 5 instructors in there, so the ratio is pretty good. What else? So something that I think is important to know that maybe you didn't know about my school is that even though we're a huge class size, they split us up into group practices. So the entire class is split into groups, I think 14, something like that, groups of 25. Not sure if my math checked out there. And so it's kind of like a cohort that you do everything with, from your like anatomy sessions to your sim lab and bench lab. And even when we get into D3 and D4 and we start rotating in the clinic, we're with that group practice. So they kind of follow you through the whole way. And even though it's a big school, it really gives it that kind of small school feeling. There's a great support network here because it is big. So I think a really big advantage is that there's a lot of people, and that means that there's a lot of resources. So there's a lot of upperclassmen who can help, and there's a lot of faculty who can help. And so I feel like my options aren't really limited when it comes to that. Experience-wise, it's in New York City. You guys already know what it's like to be in New York City. I will say being down here is a little more lively than being up in Morningside Heights. We have access to like better restaurants and stuff. Better restaurants, a little bit better life, I would say. And then, yeah, I guess that's pretty much it. We can address any questions after.
Yeah, so for me, so I'm actually originally from Florida, but then, attended undergrad in New York. So for me, yeah, the biggest decision was whether I wanted to stay in New York or come back to Florida. And I eventually chose Florida. So I think it's choosing your dental school is a very personal decision. And I don't think you should ever feel pressured by, either family or friends to kind of direct you. It is very personal. A lot of factors come into play. For me, one of the biggest ones was finances, tuition. So for me, I think the in-state tuition was a huge factor. And I also knew UF had a very good dental program. So I felt that I would get a very good education for the price. And so for me, I think that was a huge component. And I didn't mind personally coming back to Florida, at least for dental school, because I knew I would eventually have the freedom to kind of branch out, go to other places if I wanted to after dental school. So my school, it is, I would say it's kind of on the smaller side. So each class is 93 students. So you kind of really get to know everyone, everyone's names, you see them, we're all taking the same classes, you're in sim lab all together. So, it's a very tight-knit group of students, and you also kind of get familiar with the upperclassmen as well. In terms of the education at UF, the first 2 years are purely didactic and mainly sim lab courses. Then they'll kind of start introducing us into clinic, where we'll be shadowing. But then starting 3rd year and 4th year, you're just purely in clinic and just on rotations, treating patients. And I feel like I'm pretty well prepared for that transition. And I'm sure they do this at all the other dental schools as well, but we get paired with associates. So in your first year, you're paired with a D2, who's kind of like your didactic big. They kind of walk you through all, passing boards and just, getting the inside on all your didactic courses. And then now as a 3rd year, I am paired with a 4th year dental student. And for me, that's actually been really, really helpful, because just going from a mannequin to a human being is kind of pretty scary in the beginning, but having that 4th year with you, guiding you, showing you the loops, and really it just helps with the transition. So I really appreciate that, and I feel like our school really kind of emphasized that. And with COVID, once you guys all do start dental school, I don't know what it's going to be like, but things have changed with COVID in terms of how we treat patients, PPE, all of that stuff. But despite all the obstacles, we've kind of, I think like our schools handled it pretty well. We reopened fairly early on, and we're still currently seeing patients right now. But other than that, we'll discuss if anyone has specific questions. We can address them at the end.
So you actually kind of started going into my next question, which is, can you tell us a little bit about what each year is like? Hyunseo, I know you kind of went into it now, and that if you wouldn't mind, saying a little bit about what it's like at NYU, and then if either of you want to add on anything, feel free.
So first year, D1 was a lot of didactics. So what that means is basically you're taking your basic bio courses. We took biochem, we took cell bio, we took anatomy, we took physiology, we took pathology, immunology, embryology. It's a lot of classes, but keep in mind you don't take history in your core classes anymore, so it's a little more manageable. That was a little push at David for being a history major. Let's see what else. So, and then aside from that, you're in your sim lab, which is simulation lab, where you have your mannequin and you're basically doing here at least you're just doing restorative. So fillings, you're learning how to drill, and then also composites, which is actually filling the hole that you just made. That's pretty much all that we did in sim lab, and that was just pretty much on repeat until I got to my second year. So second year, I would say they started to introduce a lot more of like dental pathology and like karyology, periodontology, all of that stuff. So it's getting a little bit more dental specific now, which I can appreciate. And I think it's starting to get a little more exciting and more relevant and not feel so redundant. And now in lab, we're kind of moving towards prosthodontics, which is like dentures and stuff, and also fixed prosthodontics, which is like crowns and things like that. So yeah, and then classes, I already said we're taking more dental stuff. And then here, D3 and D4, you are mostly in clinic, but you do still have some dental courses to take, like OMP, which is oral and maxillofacial pathology. And then there's other classes. And so for us, we're the first year. So when you guys apply and go to dental school, it'll be the same, where we actually don't take our boards until fourth year. So they've integrated our boards into fourth year, instead of being part 1 and part 2, where you take one at the end of second year and then another one, or at the beginning of second year or end of second year. I'm not sure what it used to be, and so can talk about that. But now it's just fourth year, you take it at the end, and it's going to be both testing the didactics and the clinical. But they're saying they're shifting it more towards like patient-focused didactic. So they say it will be more relevant and helpful for us than just testing straight biology without relating it to a patient. We also do shadowing in our first year to kind of get us exposed to the clinic. And we haven't done that yet in D2 because of COVID, but yeah, that's kind of what it's like. I'm also in class, like I literally just got out of class at like 6:15. So you're pretty much in class from, I guess it's not 8 to 5 for us. It's more like 10 to 6. Yeah, that's pretty much it.
Awesome, thank you. So, then we've been speaking a bit about how, the classes go and your transitions and everything. Can we touch a little bit on what the student community is like? I know you said, both of you, that you get kind of to know everybody, but I just want to go into a little more detail of, how everything works. Are there, student organizations? How is the life as a student outside of classes in dental school?
Yeah, so for us, because our class size is relatively smaller, so it's about 93 per class, you'll start seeing the same faces across all the clubs and organizations. But with that, I mean, that just means we all have very similar interests. We do have clubs for certain specialty interests like oral surgery, ortho, peds, all of that. And before COVID, we also had mission trip groups. So if you were interested in, taking part in that, we would have organizations that would, essentially organize mission trips. It is on hold right now due to COVID. Hopefully that'll be back up and running. And I'm also part of kind of outside free clinics, just locally. So before COVID, before we kind of closed down for now, it was always kind of held on Wednesdays. So it's a free clinic for patients that can't come directly to our school. And dental students would kind of just take extra time after they finish school. They would, at nighttime, they would come. It's called We Care, and just provide extra service for our local community. And in terms of just kind of what people do on their free time, we, at least in Florida, football is a huge thing. So we'll have a lot of, tailgates on the weekends. So a lot of people would, engage in weekend football, but also in Gainesville, it's not New York, so we don't have many places to go out and explore, but a lot of us do like to go on the weekends or extended weekends just to beaches. We'll make the drive out, go to neighboring states for, just a short vacation. So there's a lot of fun things to do, and, you start forming really good friends within dental school as well. So everyone's very supportive here as well. And I'm sure at every other dental school too, because everyone's going through the same difficult things. And if you ask for help, or if you, seek out help will always be there for you. And so, yeah, community is great so far.
I would say my experience is the same. Yeah. I mean, no tailgates. We go out and do things before COVID, at least. But yeah, I would say it's the same.
And as far as, I know you said both of you get attention from faculty members when you're either in sim lab or things like that. Is there a good kind of support network in, across the board? What's that look like with advising? And, I know you said as well with being paired with, your bigs from other years, what kind of does that look like as far as, getting help from the administration?
So at NYU, when you first get here, they pair you with both a faculty advisor, who can be anyone, can be like a teacher, it can be someone on the admissions team, it can be someone who works for financial aid, it really could be anyone, but they're really kind of there just to guide you through the process. If you have any questions, they can give you the resources that you need. And then they also pair you with an upperclassman, which is really nice. It's not particularly the year above you. Mine is the year above me. And you kind of take that mentor throughout your 4 years, which is kind of nice. Well, I guess until your last year, whenever they leave. And then you can try and get a new one. I'm not really sure how that works. But other than that, I would say the support network is good. You can reach out to faculty via email. They're really good at answering questions at pretty much any hour of the day. I literally had a professor today that said, if you email me at 12 a.m., I'll probably respond within 10 minutes. So they're pretty good about that, yeah.
Yeah, and like I mentioned, so generally we're paired with an upperclassman who's second year in your first year. And then when you start your third year for clinic, because it is a huge transition, they'll pair you with a fourth year. Mine happened to stay the same, but other people, they would have different didactic bigs, as opposed to like their clinic bigs. And our school has tutors. So if you do feel like you need that extra help or support, whether it is sim lab related or didactic related, we have free tutors that you can be paired with. So I know gross anatomy, just like the cadaver lab, a lot of people needed help with that. So we always had tutors for group sessions to kind of help with cadavers and just anatomy, as well as SimLab. A lot of students needed kind of just, tips that students can provide that maybe faculty might not mention during class. I know that's always been really helpful for classmates of mine. And our faculty are also very accessible. If you just reach out and say, hey, I'm struggling with, this procedure, can you give me tips, or can, show me certain things? Can I come in during your office hours? And they're more than happy to meet with you. You just simply asking other classmates, your classmates who may, some people may get things a little bit quicker, or they just may have developed other techniques that might work for them. So you learn a lot from your classmates, and you're not restricted to just your kind of didactic or clinic big. You're more than welcome to ask other upperclassmen who are available or who are willing to help. And I found that I was getting help from just a wide variety of sources, but everyone's always just willing.
Sorry, there's a clock going off in the background. So as you guys, are moving into the upper classes, are you starting to look into the possibilities of doing residencies or specializing? And what would that look like moving forward? What are you interested in kind of pursuing?
So if you plan to stay in New York, even if you want to do general dentistry, you have to do a 1-year residency program. So if I don't choose to specialize, I'm still keeping my options open. Then I will definitely be following through with that 1-year residency, which you apply for in your 4th year, and you go through the whole interview process to do that. Then some people also do the GPR, the general practice residency, and then while they're in their GPR, they apply to like specialty programs if they feel like, maybe they want to do something more. And our residencies here in New York are usually in hospitals. So I think the AAGT programs are also in hospitals, so for clinics, but here they're mostly in hospitals.
Yeah, so I kind of mentioned early on, I personally, as of now, plan on applying to AEGD programs. So Annette was kind of touching on this. So GPRs are hospital-based, and then AEGDs are, they're more school, not really, more clinic-based, not really associated with the hospital. And I have been exposed to most of the specialties, and for me, what was a deciding factor for general dentistry is that I really enjoy doing a lot of things. So I don't want to be personally restricted to just doing root canals all day, every day. I love operative, which is fillings. And then I also really love doing crowns, and I would love to do bridges and dentures. So I kind of want to be able to do all of those things. So that's why I personally think I am leaning more towards general dentistry. And in terms of the AEGD, technically, at least in Florida, you don't have to have that 1 year of residency like in New York, but I feel like in dental school, at least in our school, you basically see 2 patients a day if you're not on rotation. So you really only have 3-hour appointments, 1 in the morning and then 3 hours in the afternoon. And in reality, as a real dentist, you're not only seeing 2 patients in a day. So for me, I find that an AGD will allow me to become faster and just have that the transition from dental school to a full-time working dentist. I feel like an AGD program will better prep me for that. But in terms of specializing, I know it's a little early, and I know as pre-dental students, we all kind of go in with, I definitely want to specialize in this, which is fine. I think that I'm sure you guys have all shadowed and stuff, but kind of like good words of advice that I received, at least before going into dental school, was that really try to keep an open mind, because before you become any specialist, you have to become a general dentist first. They train you to become a general dentist, and then if you find that you are more inclined towards oral surgery or ortho or peds, then feel free to pursue that avenue. But at least in dental school, they're training you to become a general dentist first. So definitely kind of keep an open mind when you do go into dental school.
That's awesome. Yeah. And kind of going off of all of the things that you've been talking about, it's really clear that you're both excited about what you're doing and happy with the choices you made in going to dental school. So with that, what's your favorite part of dental school? What's your favorite aspect or something that you enjoyed learning about, or just an experience that's made it really a good experience for you?
I would say the hands-on portion is so exciting. I mean, after shadowing so much during undergrad, getting a drill in my hand, even if it was just a plastic tooth, and like turning it on myself and pressing the pedal, I was like, oh my goodness, this is amazing. Yeah, I would say that's the most exciting part for me. Every time we learn something new, like we're learning crown preps now, and I'm definitely honing in on my artistic capabilities. It's really exciting. I love being there. I love asking the faculty for help on how I can be better. I love taking pictures and sending it to my dad and saying, look at my crown prep. That's definitely the most exciting. I did really like anatomy a lot. I thought it was super cool. I know we don't do a lot of that, and it's really complex, and a lot of students hate it because it's a lot of information and a lot of memorizing. But I would say hands down, that was my favorite class. I'm trying to think what else that's pretty much it. Yeah, my favorite part is having drill in my hand.
Yeah, so for me, I think definitely starting 3rd year has just really reminded me of why I chose to pursue dentistry. You kind of lose sight of that in the first 2 years, because you are really, it's tedious, some classes that you have to take, and it can be draining where you're just memorizing a bunch of slides, and you don't really see the application of it. And for me, I'm the type to learn best if I have to do it hands-on, rather than just memorizing something from a slide. So now that I'm able to see what I've learned in the past 2 years and being able to apply it in real life patients has been very rewarding. And yeah, just seeing all of those late nights practicing, and it's just the difficult stuff you had to get through in SimLab, and being able to apply all of your knowledge and skills finally in the clinical setting, and seeing just patients being relieved of pain or being really happy with the outcome that you've been able to produce in terms of just aesthetically, you're able to fix a lot of things for them. It's definitely very rewarding for me. And yeah, I just really enjoy interacting with the patients every day, and it's what keeps me motivated to keep coming to school every day. And not every day is going to be the best. I will say, I'm not going to sugarcoat it and say, oh, every day is so simple, like every patient is so reliable, and every procedure goes the way you expect it to. That's definitely not the case, but it's a very humbling experience, just learning from your mistakes. And every day I am in clinic, every procedure that I do, I'm learning something from it. So I think just every day seeing how much I'm improving as a dental student has been has been good. Yeah.
That's great. And then to kind of turn it around a little bit, what's been your least favorite part of dental school? Something that's kind of maybe been difficult or something that's irked you about your experience?
So I would say similar to Colombia, the stress culture here is pretty awful. It's a lot of exams. It's not like you have a midterm week and those are your exams. Like I literally have an exam every week this month, and I have multiple exams every week. So it never stops and people get really stressed. It's hard to handle sometimes, that plus all the stuff that you have to do in clinic. You have requirements, you have to hand in certain things that will be due, and you have to take out time from your studying, and maybe you don't feel like you're in a position where you can stop studying and go to the lab, but you have to do what you have to do. So it's hard. It can get a little frustrating talking to your peers, and like they're also super stressed, and yeah, so it can be a little overwhelming at times. It's not easy to be a dental student, just like it wasn't easy to be an undergrad. um, so yeah, I would say if you can do your best to like really manage your stress, it can be overwhelming at times, but there are ways to cope, and there are a lot of resources where you can figure it out. And I feel like here at NYU, we're big proponents of study hard, party hard. So work hard, play hard. So that's good at least.
Yeah, I think I'd have to agree with Annette. I think for me, just the first 2 years were probably the hardest. And you can ask anyone, and everyone's answers will be different. But I think personally for me, just the constant, nonstop exams. You're always studying. There's no break. It's like you can't really have time to breathe almost. But uh, everyone gets through it, though. At the end of the day, it is important that you have a good support system, and trying not to compare yourself to other people. It's easy to get caught up in how much another person is studying, or how many hours they spent in sim lab practicing, and you're asking yourself, oh, did I spend that much time, or am I going to be in a worse position? So it's definitely a lot of like a mental game in dental school, but just knowing that as long as you're learning the material, as long as um, you're learning the important stuff, I don't think you should feel so stressed about grades or failing or anything like that. I think you should just really, you're here for a reason. You're here to learn, and I think that's I had to kind of learn that the hard way, because being so used to being caught up in grades and all of that. But other than that, it does get better. And again, just the physical endurance of the long days, the long working days, especially when you're in clinic now and then you're seeing patients for extended amount of time. It can be a little bit draining. That's definitely a huge transition from undergrad to dental school. But other than that, yeah, everything though works out and everyone does get through it. So
It's great that you're both able to put positive spins even on what your least favorite part of dental school is. And kind of going off of that, uh, you're speaking to a pre-dental group. So would you mind just kind of imparting any wisdom, any advice to pre-dental students?
um, it'll work out in the end. Now, I was in, I don't know what year you guys are. You guys are probably across the board, but it'll all work out. Try your best while you're an undergrad. Stay focused on your goal. If you want to become a dentist, make sure you're out there shadowing. That's really important, because if you think you want to be a dentist and you apply to dental school without having shadowed, and then you get here and you realize that this is not something you want to do, then that's really hard. And I feel like I see some kids really struggling with that. a lot of kids who were pre-med and then that didn't work out. So then they apply to be pre-dent and they come here and it's just not what they expected and not what they wanted. And so definitely I would say get out there, shadow specialties, shadow everyone that you can, really. Even if you're like on Instagram watching videos, that's you getting experience and realizing what the future might look like for you. And then when you get here, I would say advice, because I'm sure if you put your mind to it, you will get here. Advice that I wish I'd given myself is if you want to be involved in clubs, get involved from the beginning. Because I feel like now that I'm a D2 and I'm still not like involved in e-boards and student government like I would have liked to, I feel like it's going to be really hard for me to get in there as a D3. So I kind of wish I had just started that from D1. I didn't think I was going to have time. I didn't think I was going to be able to balance it, but you make time for the things that you want to do and the things that are important to you. So that's advice I would give myself. Yeah.
Yeah, I'd have to strongly agree with Annette. And I think the only way you do really know if you would like to pursue dentistry as a career is through exposure, and it's through shadowing. So, but also keep in mind, try not to only shadow certain specialties, because if you only shadow ortho, that is so different from what they're going to teach you from day one when you start in dental school. You don't do that until way later on. So just make sure, for me, I would personally recommend shadowing general dentists mostly. And I think dental schools definitely look into that as well. And then after you feel like you've had a good grasp about what general dentistry looks like, then definitely I encourage you to branch out into other specialties and look into, different specialties that are there. And in terms of right now as a pre-dental student, I think you should continue taking classes that you want to. I think my biggest regret is not having taken more fun classes that I know I won't ever be able to take, because once you start dental school, it's purely just science courses. So if you wanted to take, that Spanish class or that music class, I highly encourage you to do it now, because undergrad is the best time to be able to knock out. Obviously, you're going to get your prerequisites out of the way, but then, also take other classes. At least here in Florida, we do have a lot of Spanish-speaking patients. So for me, I wish I kind of refreshed my Spanish. I feel like it would have been really useful in the clinic setting. So just stuff like that. Enjoy your time. Enjoy the free time for sure. And there's also no rush. Like, I don't think you should feel like you need to, have no gap year and just go straight into dental school. Obviously, you can if you want. But there is a lot of time. You shouldn't feel like you have to take the DAT, have all your recommendations in just so that you can go straight into dental school. There really is no rush. And yeah, I think just take your time with it is my biggest recommendation. And even when you start dental school, even though you have less time, significantly less time than you did in undergrad, like Annette said, you will make time for the things that, matter to you, whether that is through organization, involving yourself in organizations, or just during breaks, not studying and really saying, hey, I want to take this time off. I want to go travel somewhere. You can just come back more refreshed. So I find that a lot of my classmates and I, we do study hard, but we, at the same time, we value our mental health, and we make sure we, we still engage in our hobbies, go exercise, all of that stuff. And I find myself doing a lot of this stuff more than I did in undergrad. So you'll make time for it.
I will also add, taking a gap year, it's a good idea. It doesn't sound like it when you're there, but it's a good idea. I wish I had done a gap year. I'm really young here. I feel like a lot of people are older than me. They have more experience with like life and the world, and dentistry and just everything. And I feel like a gap year could have really been an asset to me. And I think if that's something that's in the cards for you, you should really consider it, because for a lot of people, it makes them a stronger applicant. And not only that, it makes you a better person too. I didn't get a break. It was like I finished in May and graduated. I had 1 month off, and July 1st, I was studying biochemistry. It was like crazy. So, like, I felt the burnout a little bit. It's kind of hard, I'm not gonna lie. And I'm still feeling the burnout. And I feel like people who had that year to kind of step back and do other things came back a little more refreshed and like ready to get back into the books, which I feel was super beneficial.
Thank you for that. And we have about 10 minutes left. So at this point, I kind of want to open it up to if either of you have anything else you want to add, or if somebody has, questions. This is kind of our informal Q&A section. So if you have any questions at all, anybody jump in and, feel free to ask.
Hi, I have a question. First, thanks for coming and like speaking. I find it really helpful as a pre-dent to be able to talk to like current dental students. I think it gives a really like very meaningful perspective. But Annette was kind of talking about it, but I know Annette, you didn't take a gap year, but if Hyunseo, you took a gap year, if you could like speak about like what you did and like how it was helpful for you if you took a gap year. I don't really know if you took one. And if not, if you could like, if maybe both of you could talk about like your interview experience and how you like prepared for that and stuff like that, that'd be cool.
So I also personally did not take a gap year. And like Annette, I was a little burnt out because I also graduated in May, and then I opted to do some research in the summer before I started. So that definitely was a little bit draining. But like Annette said, our class, at least my class, ranges from really young people who did a 7-year program, younger than me, to people who are married and like in their middle 30s. And I've noticed that the older students do tend to, they handle dental school a little bit better just in terms of stress management. And a lot of students have also taken master's or completed master's programs. They did have a leg up, I would say, in the basic science courses like gross anatomy. They've already taken gross anatomy, so besides that, it's absolutely necessary for you to do a master's program. But if you are interested, I think a lot of people during their gap years, that's what they would pursue. Other people would they worked as dental assistants during their gap years if they could secure a job and be trained on the spot. I have other people who have worked in dental labs. Again, none of this has to be specifically dental related. I know people who decided to teach for a year, middle schoolers or something like that, and that's completely fine as long as you can justify. I think dental schools just want to see that you were productive and you weren't kind of just being lazy, taking a year off. You could either be taking more courses, um, let's see, I kind of looked online. Oh, sorry, I think my internet.
Yeah, I think you're cutting out a little bit. If you don't mind, maybe just repeating the last couple things you're saying, if you're able to.
Yeah, Where did I get cut off? Sorry, my internet's a little unstable right now.
It was around, you said being productive during your gap year, and then some people teach things like that, and then it kind of started getting a little bit wonky.
Oh, sorry. Yeah. Um, so yeah, during your gap year, as long as you are productive, that's all they really care about, and as long as you can talk about during your interviews. And in terms of interviews, it's honestly so different. It depends on the school, so you just have to do your research. I'm wary to recommend SDN, I think Student Doctor Network. That is what I use because I didn't have connections to current students, at least at UF here. But I think just getting outside of how the interview structures per school is valuable information. Just in terms of, is it multiple mini interviews? Is it just one-on-ones? Is it, group interviews? All of that stuff. And every school is different. The two, so I didn't apply to many schools, and I only attended 2 interviews, and they were drastically different. The first one is just super laid back, interviewed by an alum of the school, and that was basically kind of it, and we just had very informal conversations. So it was kind of up to me to bring up my strong points and like what I wanted to highlight in my application. So if you're in that type of a situation, I do recommend that, if there are certain points of your application or your personal statement, all that stuff that you want to highlight, it may be your job to bring it up. And then at UF, at least it was definitely more structured. It was like 3-on-1, and they kind of just start asking their own questions, and always be prepared for what is kind of like the weakest part of your application or as an applicant. Questions like that they will want to ask, and they don't want to hear kind of like a cliche answer of, oh, I'm a perfectionist. So I find that, I can't adapt to certain situations because I have to have everything perfect. Stuff like that. Just have like a meaningful, reason why. And if you do find a weak point in your application, whether it may be your GPA or your DAT score, stuff like that, just have a good answer as to why, that is. Like maybe that semester you had it rough, something, personal issues, or a certain course is very difficult, and they'll understand. But as long as you have an answer for, any weak spots of your application, I think, you'll be well prepared. But any other specific interview questions, feel free to ask. There's so many, but Annette can definitely address certain stuff too.
Yeah, I agree. I was just going to say hop on SDN. I didn't know, but apparently all of my interview questions were on SDN before I interviewed. So like after my interview, there was like kind of a group thing here at NYU at least. And then I kind of mentioned a few of the questions. They were like, oh yeah, I saw that on SDN. And I was like, oh, I didn't know that, but okay. Like they asked me who's the dean, and I said the dean of admissions name instead of the actual dean's name. But apparently that question was on SDN. Just be prepared for anything. I've got some weird questions too. Someone asked me, you're in the back of a cop car, what did you just get arrested for? And I was like, what? So just be prepared for anything. They get creative. Group interviews are interesting. I would just say be professional, practice, get people to ask you questions, look on SDN. And then I saw someone asked, how is financial aid at your school? So in my school, they don't give financial aid to everyone, but if you're eligible, you can submit the FAFSA, and they will pick certain students. They have like a certain amount of grant money, and they pick certain students to give grants to. I have a really big school. I think they only pick like 25, 30 kids to give grants to. It's not full tuition, but I know that they do give them a pretty substantive amount. But other than that, my school at least doesn't give much, and it is very expensive to go here. So keep that in mind. I really wanted to stay in New York because my family's from New York, and I also really wanted to be at a school where my clinical opportunities were going to be bountiful and I was going to graduate super competent, which I knew was going to happen at NYU because there's a huge patient population. I'm never going to have a problem getting patients. I know Hyunseo mentioned that she only sees two patients a day. Our D3s and D4s are in the clinic for like 8 hours, and they see as many patients as they want to in those 8 hours. So like if they think that they can do a cleaning in 30 minutes or 40 minutes, they'll schedule that for 40 minutes and then schedule 3 hours or whatever for the next patient, which I think is really cool. It is need-based. They're not merit-based. The financial aid is not merit-based. It's, yeah, that's why they take your FAFSA. So I think it is need-based, yeah. Yeah, I forgot what I was saying. Oh yeah, patients. That's why I chose NYU, and yeah, okay.
Yeah, so in terms of financial aid in grad school, it is mainly need-based. But if finances are a concern, again, just look at tuition, private versus public. And at the same time, there's also a lot of classmates they're either Army, Air Force, Navy. There's a public health, that's like, I forgot what it's called, but if you commit to, I mean, the amount of years that this program pays for your tuition means you're basically just going to serve in an underserved community for those amount of years. So that's another program that's out there, and they completely cover your tuition. I believe also offer a stipend, as well as like the Army, Air Force. If you also qualify for that, your tuition is covered, and you also receive a stipend. So there are various options available.
Does anybody else have any burning questions? Anything anything at all? If not, I'm gonna say thank you so much, guys, for coming and speaking to us. It was great getting to see you both, and I really learned a lot. I know everybody else learned a lot, and we really appreciate you coming out and speaking to us. This was really great. Thank you so much.
No problem, guys. Good luck. If you have any questions, David, you can give them my email. If they have any questions about NYU, if they get an interview and want some advice or something, you can always reach out to me.
Same for me as well. You have my email, so feel free to share it to those who would like it and would like to reach out. Feel free. It could be about anything, application process, when to apply, which schools to apply to, all that stuff. But good luck, guys.
Thank you.